Laser eyelid surgery, also known as laser blepharoplasty, is using the CO2 or carbon dioxide laser as a method of removing the excess baggy skin and or fatty tissue in the upper or lower eyelids. Since the mid-1990s, I have been using the CO2 laser exclusively for all of my blepharoplasty or eyelid surgeries, which makes us extraordinarily unique, as there are really very few offices that have the laser full-time within their office to be able to use it. By removing that excess baggy skin on the upper lids, most patients notice a tremendous improvement in their peripheral vision. Additionally, they notice that their eyes don't feel as heavy or tired. Their eye strain, brow strain, and sometimes even headaches can be relieved immensely. By removing the fatty pockets in the lower lids, much of the puffiness can be removed, and it gives patients a much more rejuvenated and refreshed appearance, which ultimately it gives them a much higher degree of self-confidence and self-esteem, and especially those individuals who are searching for new positions or new work, makes them feel much better about themselves. Laser eyelid surgery typically takes approximately 20 to 30 minutes for both upper lids and 20 to 30 minutes for both lower lids. The return to activity is fairly prompt, and certainly most day-to-day normal activities can be resumed within 24 hours. Typically, we do tell our patients that they should expect some degree of bruising and swelling. There are ways to keep that to a minimum, and that may take anywhere from 1 to 2 weeks to resolve. For our patients who are only having upper eyelid laser surgery, that procedure is typically performed just under local anesthesia. And what that means is that the lids are very slowly and gently numbed. The patient does not feel any pain. The patient is awake during the procedure, and when we finish, there's a very fine, delicate weaving stitch in the upper lid crease, which we remove the following week. For those patients where we perform lower eyelid laser surgery, that typically is a little bit more stimulating, so I always recommend to our patients to have a little bit of intravenous sedation or twilight anesthesia, which is administered by our anesthesia team, and to make it a very comfortable and pleasant experience. Laser eyelid surgery, in my opinion, is a life-changing experience in that you can help patients both functionally by improving peripheral vision, by improving eye strain and heaviness and sometimes even headaches. But in addition to functionally improving their life, you can improve their life by giving them more confidence, more self-esteem, and just feel much better about themselves.